Namaste viewers and friends. I would like to thank all the latest subscribers who have subscribed to our YouTube channel for viewing all the videos. We have several videos till date. More than 80 of them have been uploaded to our channel on various topics, chronic ailments and how to manage it with yoga, acupuncture, naturopathy, and several videos about natural living, preventive aspects, all those videos. We are very happy and thankful to all the subscribers. We would like you to share this information with all your friends, groups and communities so that the healthy living aspect and preventive aspect spreads across the whole human race. Today I have come up with a very known subject, very prevalent ones, especially in most of the regions of our world, that is bronchial asthma. Asthma is something which you might have heard about it. Bronchial asthma. Bronchial means it is to do with the air pipe. We have right from your nostrils, from the nose through the air pipe, it branches out to two different lungs on both the sides with small tubes, which we call it as bronchi. So asthma is an inflammatory condition in the sense because of allergies, what several people are allergic to, maybe dust, pollen, sometimes even foods. They all, weather changes and change in sometimes I've heard even that a small cloud coming in, the body recognizes and an asthma attack creeps in. So that sensitive our systems can be. What exactly happens? All these allergens, all these factors will release lot of hypersensitive chemicals, immune cells, which will cause bronchospasm. Bronchospasm means it is the spasm of the airway. When that happens, automatically you can't breathe well, and the mucus which is there in the bronchi, in the air pipe, becomes accumulated. That leads to congestion, and that's what causes wheezing, one of the main symptoms of bronchial asthma. You'll not be able to breathe well, so the oxygenation levels will be lesser, your tissues are starving of oxygen, metabolism is taking a beating, you feel fatigued, you can't focus, and this keeps happening on and off for several years. For several people suffer for many years together. Why does this happen? This inflammation, this changes within our system, why does that happen? It is because the hypersensitive overreaction of our own immune system for various reasons. One of the factors we have to understand in traditional medicine is, it is asthma, as I told, bronchi is related to lung. Lung energy in terms of traditional Chinese medicine or even in terms of Ayurveda, yoga, naturopathy is very important for our overall health and well-being. So a deficiency in that is one of the major factors for these things to happen. In modern medicine, modern science may not be able to explain beyond a certain level why this hypersensitivity happens. We just know it happens. But why it happens? It's because of these deficiencies. That's the reason many a times these deficiencies run in families, generation to generation. That's why genetically also we can get asthma. So that's how asthma is caused. That is what asthma is. Many a times these days we have acute situation medication like inhalers. Thankful to the modern science, those inhalers prevents our fatal condition of status asthmaticus, which is a very serious condition where you can go into a fatal situation. We can prevent all those things. But can we go on taking inhalers on a long term? It has its own adverse effects on a long term basis. So what is required? So we need to work on the aspect of improving our lung capacity, lung functioning, reduce the inflammation, reduce the hypersensitivity of our whole system. So what care we have to do about that? So several things needs to be taken care about it. When there are two-phased approach for asthma treatment or management of asthma. One is during the acute condition, during the chronic, during the phase where you don't have attacks but you are still having mild wheezing and difficulty in breathing. So during the acute condition, we address the symptoms probably with inhalers and also some of the alternative medicines like acupuncture and few herbs, changes, all those things to reduce the dependency on the inhalers. But when off season, when you don't have the attacks, maybe in summers, or for some people even in summers there will be attacks. So when there is off season, that is when we have to work on strengthening our lungs and changing our lifestyle. Many times food habits are also contributing factors to a large extent to increase the phlegm in the system, in our bodies. So we have to avoid all those foods which causes those aspects of increasing the congestion, and also those foods which has to be reducing the inflammation. So we have to follow an anti-inflammatory diet and anti-phlegm diet. That is what is very important when we don't have the attacks happening. At the same time, yoga practice has been proven beyond doubt, and several studies has been done that how effective the pranayamas, breathing techniques, and also relaxation techniques including yoga nidra, shavasana, meditation, to reduce this inflammation and improve your lung capacity so that the air movement becomes easier, wheezing reduces, and you are better prepared for the next season when you have an attack. Acupuncture also helps in the same way. I have seen in my own practical experience that when you have severe wheezing, 30 minutes of acupuncture makes their chest tightness or compressed feeling very eased. They will feel, oh my God, how nicely I am feeling. It's after a long time I am feeling this. That's because it will loosen up the whole tightness. With the acupuncture needles getting into you, the inflammation reduces, you become much more calm and peaceful. That improves your lung capacity. At the same time, when an asthma attack is there is a lot of fear and anxiety, stress as well. That will further enhance the bronchospasm. That's where acupuncture also would help to make that nullified. At the same time, acupuncture, as I mentioned, in the perspective of traditional medicine, improves the lung energy. Lung energy in traditional Chinese medicine is meant for defensive mechanism and also to boost your core energy, what we call it as chi. So that is where lung is very important for us. So acupuncture helps to improve the lung deficiency, and at the same time it is working on us to become much more calm, peaceful, which will also help us. And at the same time, lot of neurotransmitters are released. Your sleep aspect becomes very well, your immune function becomes better, inflammation reduces. These are multiple things which can happen with acupuncture. So when there is acute situation, we require many sessions, but when there is chronic situation or off-season situation, you just need to maintain and improve your system. That's why many people ask, how long do I need to take the treatment? During the acute phase, you have to take frequently, but during the off-season phase, you need to take the treatment so that the next season you don't get that problem in that intensity. I personally have seen that some of the patients who are suffering from 30 to 40 years, their requirement of inhalers has gone down with acupuncture and yoga. Their frequency and intensity of wheezing and the difficulty in breathing has reduced to a large extent. So that is how effective it can be. It is just that we need to be sustained and approach the right doctor who has knowledge of both traditional perspective and the modern perspective, so that we have a holistic approach to prevent this and have a healthy quality life. So that is about asthma. I am sure all the information about asthma we have shared, and this should be helpful for you. And if you need any of the details or if you require any of these treatments, you can approach us, Anandamaya Wellness. You can find us on our website anandamayawellness.com, on Facebook and Instagram as well, Anandamaya Wellness. If you search, we are there to help you holistically, ethically. Thank you so much for your time and your patient hearing. Thank you.